Welcome to the use of Giga for the purposes of helping healthcare practitioners. Here we have an example of both a repository and a use by physicians. In the repository are these mountains of understanding behind every medical and medicine subject. Here we have a specific example of a glaucoma repository. And in this repository are lots of opportunities to understand glaucoma from a number of different points of view. All of these applying the GigaIntelligence rubric of shared understanding. There's a summary, a must do, could do, should do, trending, experimental, research, vendors, physician's opinion, trending, best, interrelationship with other conditions. And behind each of these, such as must do, is an opportunity for a community to build the mountain of understanding from this particular point of view or strategy. What must one do when diagnosing or having come upon a case of glaucoma? And in this performance summary assessment, which can be performed by many contributors, it follows the 11-dimensional GigaIntelligence rubric. Those topics include context, perspective, importance, wisdom, insight, knowledge, data sources or news. This is where analytics is brought in. Current, future, risk, and opportunity. Altogether, these 11 dimensions present one thought, one perspective, one point of view. In each of them, at every one of these, has the opportunity to bring in AI. So AI, such as these options here, can contribute to every single point in this assessment process. And AI can be applied to the entire data set. So there is an opportunity in this repository to build up these mountains of understanding from a huge community that rest upon and on top of all the analytics. Analytics being all the data and all the information. So as described, there are two parts to this. One part is the buildup of a repository. And the repository becomes the source that physicians, healthcare providers can draw from and apply to individuals, patients. So again, we're back here looking now at physicians. And the mythical physician we have is Dick Devlin, MD. And Dick Devlin has a couple of different categories. He has patients. He has his own private assessments and thoughts. Maybe there's some research that he's conducting. We'll dive down here into patients, and we come into Betty Bresnahan. Betty Bresnahan is a patient of Dr. Devlin. And these are the issues that Dr. Devlin is working with patient Betty Bresnahan. There's a summary. She has glaucoma, and he's gone into the repository and brought in must do for his reference and potentially her reference that she can see in her portal. Mammogram is something perhaps she should do, and he wants her to understand why and how. And maybe he's encouraging her to pursue a heart-healthy diet. So this is under the trending category, the trending perspective. And behind every one of these now is the same opportunity, for instance, in the glaucoma, to bring in from the repository what is the must-do and give Dr. Devlin an opportunity to tailor it specifically to Betty Bresnahan. So again, this follows the Giga rubric of shared intelligence, providing understanding. It sits on top of the EHR. It sits on top of all the AI that can go to or through data on an EHR. And it brings that to a higher level by filling it out with these levels of intelligence, which provides understanding. That concludes this presentation.